Good morning everyone. In this video, we will learn about the renal failure. Okay, first we will see about the introduction. What is renal failure? Renal failure is refer to the failure of excretory functions of kidney. It is usually characterized by decrease in glomerular filtration rate. So the glomerular filtration rate is considered as the best index of renal failure. However, decrease in glomerular filtration rate is not affected much during the initial stage of renal failure. If 50% of the nephrons are affected, glomerular filtration rate decrease only by 20% to 30%. It is because of the compensatory mechanism by the unaffected nephrons. The renal failure may be either acute or chronic. Acute means temporary and develops quickly. Chronic long term condition that is slowly get worse. Then we will see about the stages of kidney disease. Stage 1. Your glomerular filtration rate is higher than 90 but below 100. At this stage, your kidneys have mild damage but still function normally. Stage 2. Your glomerular filtration rate may be low as 60 or as high as 89. You have more damage to your kidneys than in stage 1, but they still function well. Stage 3. Your glomerular filtration rate may be as low as 30% or as high 59. You may have mild or severe loss of kidney function. Stage 4. Glomerular filtration rate may be low as 15 or high as 29. You have severe loss of kidney function. Stage 5. Glomerular filtration rate is below 15. Your kidneys are nearing or complete failure. Okay, next we will see about the acute renal failure. Acute renal failure is the sudden stoppage of renal functions. It is often reversible within few days or few weeks. Acute renal failure may result in sudden life-threatening reactions in the body with the need for emergency treatment. Okay, next we will see about the causes of acute renal failure. First one is acute nephritis. Acute nephritis means inflammation of kidneys, damage of renal tissue by poisons like lead, mercury, and carbon tetrachloride. Then renal ischemia, acute tubular necrosis. Acute tubular necrosis caused by burns, hemorrhage, snake bite, toxins, and drugs. Then severe transfusion reactions, sudden fall in blood pressure during hemorrhage, diarrhea, severe burns, and cholera. Blockage of ureter due to formation of calculi. Then features of acute renal failure. First one is oliguria. Decreased urinary output is called oliguria. Anuria, cessation of urine formation. Then proteinuria. Appearance of proteins in urine is called proteinuria. Or is albuminuria? Excretion of albumin in urine is called albuminuria. Hematuria. Presence of blood in urine is called hematuria. Edema due to increased volume of extracellular fluid caused by retention of sodium and water. Then hypertension within few days because of increased ECM volume. Then acidosis due to retention of metabolic end product. Then last one is coma due to severe acidosis. If the patient is not treated in time, resulting death within 10 to 14 days. Next, we will learn about the chronic renal failure. Chronic renal failure is the progressive, long-standing and irreversible impairment of renal functions. When some of the nephrons lose the function, the unaffected nephrons can compensate it. However, when more and more nephrons start losing the function over the months or years, the compensatory mechanism fails and chronic renal failure is developed. Then we will see about the causes of chronic renal failure. Diabetes, heart disease, chronic nephritis, polycystic kidney disease, renal calculi or renal kidney stones, urethral constriction, hypertension, atherosclerosis, tuberculosis, slow poisoning by drugs or metals, long history of taking pain relievers. Then we will see about the features of chronic renal failure. First one is edema, failure of kidney to excrete sodium and electrolytes causes increase in extracellular fluid volume resulting in development of edema. Then blood loss, gastrointestinal bleeding accompanied by platelet dysfunction leads to heavy loss of blood. Then anemia. Since erythropoietin is not secreted in the kidney during the renal failure, the production of RBC decreasing, resulting in anemia. Then fourth one is hyperparathyroidism. Hyperparathyroidism is developed due to the deficiency of calcium. It increases the removal of calcium from bone resulting in osteomalacia. Then uremia. Uremia is the condition characterized by excess accumulation of end product of protein metabolism such as urea, nitrogen and creatinine in blood. Uremia occurs because of the failure of kidney to excrete the metabolic end product and toxic substances. Then we will see about the common features of uremia. Anorexia, lethargy, drowsiness, nausea and vomiting, pigmentation of skin, muscular twitching, tetany and convulsion, confusion and mental deterioration. Then last one is coma. Then acidosis. Acidosis, uremia result in acidosis which leads to coma and death. Thank you.